This is a special edition of Meidas Health. I'm here with Dr. Vin Gupta, who leads Meidas Health, which has been a hugely successful podcast bringing together some of the top individuals in the health space, former leaders in government, former leaders in private, current leaders in private practice, people who are sharing a wealth of information to combat the disinformation. This is an emergency episode because we're seeing right now a huge, looks like revolt developing inside the CDC. First, we see the CDC director being ousted. We've learned that she was pushed out. The facts that we're getting right now is that she wouldn't go along with what RFK Jr. was demanding. This is the Washington Post exclusive. CDC director ousted. Top officials resign after RFK Jr. pushed to change vaccine policy. Susan Monarez was confirmed as the CDC's director in July. 3 top agency officials announced resignations as the Trump administration pushed her out. So the director's out, the CDC head of zoonotic division resigns, the CDC medical officer resigns, head of CDC's vaccine unit resigns. And this follows RFK Jr. announcing new limits on who can get the COVID vaccines. As new variants surge, patients must now see a doctor before getting vaccinated instead of booking directly at a pharmacy. The emergency use authorization for COVID vaccines are now rescinded, Kennedy has said. And he's also basically been encouraging people to then sue their doctors if they're prescribed the vaccines. Very dangerous indeed. And then we saw a few weeks back, there was a domestic terrorist attack at the CDC office from an anti-vaxxer who was using all of this rhetoric from kind of MAGA world. A black police officer was shot and killed, was there heroically. I mean, you were talking about hundreds of bullets being shot at the CDC building there, and you didn't hear a peep from Donald Trump or the government about a terrorist attack on U.S. soil at the CDC building. And so I think there were lots of people reeling from that at the CDC, that they were targeted and nobody had their back. It almost seemed like the terrorist attack was being encouraged in a way by the government. And then this attack on vaccines. Dr. Vin Gupta, I'll shut up because I'm not the expert on this. I just pretend to play one on YouTube. You're the real expert. Tell us what's going on.
Yeah, but I mean, Ben, that was a comprehensive tee up, and it really hit the high points. What I want to make sure our listeners are really focused on is, let's take the COVID vaccine and guideline changes before we get to the CDC leadership mass resignations, forced resignations. What happened today is that RFK basically made good on what he was signaling for a very long time, which is he is taking away ready access to vaccinations that we know have a tremendous benefit versus risk profile. These are beneficial vaccines for anybody that wants them, certainly for those that are medically higher risk. The risk profile we've discussed ad nauseum for the last 5.5 years is minimal and well studied. But he's making good on this. And so today what happened is he basically said he's only limiting for adults. Those vaccines, COVID vaccine boosters, will be available to those 65 years of age and older, basically saying anybody that's in his view otherwise healthy and younger, he's not going to allow for it. And so why does that matter? First of all, there's a lot more people that then still end up in the hospital with COVID-19 many years into, post-pandemic, than I think we want to talk about and acknowledge more broadly. He doesn't want to really talk about the burden, but we're talking about thousands of people. This is not something that's limited to those that are medically higher risk. Thousands of people still end up in the hospital, some in the ICU. It's very unpredictable. I see it directly firsthand. So he's minimizing the dangers of the virus still, even though those dangers are not what they were 5 years ago. We all acknowledge that. Number two, there's a lot of reasons why people want to get these vaccines that are now no longer able to get them as easily. They live in a multi-generational household with mom or dad that might be older, that they might have somebody that has an underlying condition. They may be worried about long COVID, which we know the vaccines protect against to some degree. At least that's what emerging evidence shows. So there's a lot of reasons why these vaccines, for no good reason, there's a lot of reasons why these vaccines should be accessible to everybody that wants them. And for no good reason, he's deciding against that. Here's why this matters to all our listeners. Because the FDA indications have changed. Number one, if a physician or any medical provider were to say, you know what, I'm still going to give it to you, or recommend that you get this, and they prescribe it. If I were to say prescribe it to you, Ben, I'm opening myself up to a lawsuit. And he directly signaled that providers that go against FDA indications for any vaccine, now that he's changing them, are going to open themselves up to potential litigation. It's a shocking abuse of power. That's one. Number two, most people get their vaccines, Ben, across the country at a retail pharmacy. While I, as an MD, can still contravene what our HHS secretary says and prescribe things off label, pharmacists cannot. And so if pharmacist no longer is able to actually prescribe and administer a COVID-19 booster for something that doesn't meet strict indications, they do not have the leeway that I do as a physician, which means access today is severely constrained, and he has a lot of power through his pen. So it's important to recognize the impacts that RFK can have on access, where he's playing that out because of the ways in which his policies impact what happens at the pharmacy down the street from all of our listeners, number one. And two, in terms of the risk benefit that now providers engage in, the threats that now we open ourselves up to, should we do something that he may disagree with, but for which there's a lot of evidence to support what we would want to do, which is say, give people the booster if they want it. So there's a lot here. More broadly on the purges, seeming purges and loss of expertise, I should say for everybody listening that Dr. Monarez, Dr. Das Galassos, who led the Respiratory and Immunizations Division at CDC, who was the chief medical officer, who also resigned. The head of the vaccine unit resigned. I mean, this expertise is not easily replaceable. These are individuals that had bipartisan support. Dr. Monarez served in the Biden administration. She's now the director in the Trump administration, broadly acceptable to both sides of the political aisle. These are experts. Again, we don't have a deep bench of experts with broad bipartisan support. And so this is a big deal, number one. Number two, we're losing people like the head of the zoonotic diseases section of the CDC. Somebody might wonder, what the heck is that? The zoonotic diseases are diseases that jump from animal to human, much like we think COVID-19 originated from animal to human, much like Ebola, avian flu. These are zoonotic diseases. And now we don't have a head of that division. We don't have a head of the vaccine unit division just as we enter respiratory virus season. We don't have a director. And this is, by the way, the second time Trump has tried to install a CDC director to no avail. So my worry is who replaces these individuals. And if it's anything like what we've seen with these vaccine advisory committees, we should all be worried, because those people will not have bipartisan respect. They will not have the respect of their medical peers, those of us actually doing the hard work of patient care. And that's a bad thing, because then they will be motivated by wrong incentives to line their pockets, incentives to stay in power, not to do the right thing, which is in line with the Hippocratic Oath.
So where do we go from here? What happens next? What should we be looking for?
That's a good question. I mean, personnel matters, human capital matters. And so we should hope, and this is where MeidasTouch and Meidas Health will play an important role, but I issue this as a call to everybody. We should expect that Senator Cassidy of the Republican Party, a physician, steps up finally and starts to intervene here on selections and nominations and who's leading these agencies. He's stayed quiet. He has a lot of authority sitting on it as the chair of the Health Committee to really, which is the leading health committee in the U.S. Senate, to determine who is in the position of CDC director. And he needs to start to exercise that. So that's where I think we all can play a role, because he does seem to be waffling a bit. Who are those senators and Congress people that we can persuade and really ramp up that public pressure? Because what we don't want is somebody like a Robert Malone. We don't want a Marty Makary, who heads the FDA commissioner, or who heads the FDA as commissioner. We don't want a Jay Bhattacharya, who is the current head of the NIH. We don't want that phenotype then to populate the CDC, because Bhattacharya, Makary have shown a ready willingness. There's a reason why they remain in their positions. They have completely neglected their duties to the Hippocratic Oath and to the profession, and are willing to line up behind RFK, which is why they're still there. There's a reason Monarez and all these docs at the CDC were forced to resign, because they were not willing to do the same. So it's political pressure, public pressure on Cassidy, and folks that I think are persuadable now because they're seeing what we're all seeing. That's one. And two, we have to continue efforts like Meidas Health and really try to fill the gap in lack of trusted health information from the federal government through these alternative means.
The news that we're getting as well is that Monarez declined to immediately resign and then enlisted the help of Senator Bill Cassidy of Louisiana. He was the one who said, I'm going to trust Kennedy. Kennedy gave me his word. And then Kennedy proceeded to just do the exact opposite of what he promised Monarez. So Monarez declined to resign, enlisted the help of Senator Cassidy, chairman of the Senate's Health Committee, who cast the pivotal vote for Kennedy's confirmation after securing commitments to protect vaccines, said three people acknowledged. Cassidy privately pushed back on Kennedy's demands, the people said, further angering Kennedy, who lambasted Monarez for involving the senator. And so that also led to this. And so we're really seeing, and from you, from a doctor, from someone who's an expert in this field, to see someone like RFK Jr. now imposing his quackery that's going to result in people dying. To your point, it's why we need Meidas Health. We need to get out this information. We need to bring the experts together, because there's always used to be a bipartisan issue. We didn't view the CDC and some of these issues as really being, Democrats feel this, Republicans feel that. We all should want to do the things that keep us alive and what science dictates, but that's not where we're at. Anything you want to say before we go there, Doc?
Just on Meidas Health, first of all, Ben, thank you for those comments. I couldn't agree more. Cassidy has an opportunity, number one, to save his legacy, frankly, because he is responsive. He may think he's responsive. He's trying to be responsive to his constituents. He's an elected official. He should do that. But he is also accountable to the field of medicine. And that got him a start in his career. I know he cares about the field of medicine. Many of the things that led him to where he is today in the U.S. Senate were formed on the commitment to public health. And so I am hopeful that some things are reversible. Some of this damage here is reversible, but it's going to take him to really do it. And so one, he has an opportunity still to course correct, and I hope he does. And that's where we're going to put some pressure on him, even heighten up the pressure. And number two, I'll just say for all your listeners, our listeners, Meidas Health episode 14 is going to be released this week. It is with the president of the American Academy of Pediatrics. And Ben, we talked exactly about the loss of expertise in the government just yesterday, one day prior to the events at the CDC today. We're just losing expertise. And so what's happening? We're having entities like the American Academy of Pediatrics directly take the fight on evidence-based medicine and that advocacy to RFK. They actually butt heads pretty vividly over the weekend about this change to COVID-19 vaccine policy. But we're seeing these signs now, people saying enough is enough. Historically, I would say not conservative, but historically reticent entities like the AAP that were reticent to say directly challenge the incumbent HHS secretary are saying, you know what, enough's enough. If it's not us, then who will do it? And that's our mission also at Meidas Health. If it's not us, who's going to platform expertise? It's up to us.
Dr. Vin Gupta, thanks for doing this emergency episode. Check out the new episode of Meidas Health. We appreciate you as always.
Thank you.
Thanks for watching. Be sure to add the MeidasTouch Podcast on Apple Podcasts, Spotify, or wherever you get your podcasts for new updates every single day.